June is Men's Health Month, and joining us live to talk about this and about the preventable health problems men face is Dr. Diego Rubinowicz. And again, he is joining us live. And Doctor, it's a pleasure having you on the show. First, tell us, why are men so unlikely to get the checkups that they need?
Well, that's a good question. We know that women usually tend to live longer, about 5 years longer than men, because they tend to go to the doctor 2 times as often as men. Men are very reluctant to go to see their physician, even when they're sick. The reason is, I think some men are scared of what they're going to find out and how it's going to affect them. And so, it's something that we have to work through, because it's very important for men to seek help when they need it, and even for checkups as well.
Right. And what diseases are they exposing themselves to not going to the doctors?
Can you repeat the question? I can barely hear you.
No, of course. We just want to know, are there other diseases or possible diseases that they are exposing themselves to by not going?
Yeah, of course. Yeah, it's very important for men to get checkups yearly, starting at age 45 to 50, depending on their family history. The main conditions that affect men are the top 3 cancers are prostate cancer, lung cancer, and colon cancer. And obviously the #1 killer in the U.S. is heart disease. So 1 in 4 deaths are from cardiac disease. So it's very important for men to come forward and get checked out and get screened for some of these conditions.
And I kind of want to go back to the first question here, and especially because there's this new study from Cleveland Clinic, and they found that men don't even like to talk about health care. And what do you think can be done to change this?
Well, I think it's very important to show men that if they come to the doctor, there's a lot of conditions that are preventable, and we can help them reduce the incidence of disease or the severity of the disease by catching it early. So early detection is the key to successful diagnosis and treatment.
And Doctor, just any last-minute tips or advice to the men in our lives on getting those checkups that they need? Anything you'd like to share?
Yes, please. Very important for men to start getting their prostate cancer screening at age 40 if they have a family history. Or black ethnicity, or also any other men starting a family history at age 40 or age 50. Colonoscopy start at age 45. Dermatological evaluation once a year. Cardiac checkup, very important to have their physical exam, blood pressure, cholesterol, hemoglobin A1C, all things that that can help prevent heart disease and some of the most common cancers. As far as the prostate cancer, which is the #1 cancer in the U.S. with 243,000 cases diagnosed in the U.S. for 2021, we recommend a yearly blood test called PSA and a prostate examination. So that highly recommend. And now men that recently had a COVID test can experience a false elevation in this blood test. So it's very important that they get this test checked by the urologist or the primary care physician. They can advise them properly.
Some great and important information there. Dr. Diego Rubinowicz, thank you so much for joining us today.
Thanks, my pleasure.